Okay, welcome to my takeaway number 4 from the recent SOSORT conference on scoliosis conservative treatment, a research society meeting that we had in Croatia a couple of weeks ago. I want to share my takeaway number 4. Well, I've already done 3 other takeaways, so make sure you check those out. And this one's a good one. This is, I think, drives a lot of success with treatment. So here's takeaway number 4. Okay, takeaway number 4 from the SOSORT conference is compliance. This is not an exciting thing to talk about because it's being compliant with bracing, being compliant with your scoliosis specific exercises and things like that. A lot of research is being done about compliance for treatment. And not surprising, we're finding that the more compliant someone is with treatment, the better their outcome is. So there were multiple studies that looked at this that we reviewed in Croatia. So one of those looked at the number of scoliosis-specific exercise sessions in a year and looked at if that correlated with how well that person's scoliosis curve did. And it did correlate. So the more sessions that they did of scoliosis-specific exercise treatment, the better their scoliosis did in reducing the curve or stopping progression of the curve. So the big takeaway with that is we might be under-treating with our scoliosis-specific exercise with Schroth method or the SEAS approach. The more sessions that are done, the better the result. So that also begs the question, how do we get those sessions in? Sometimes I think we should start to do more group classes where multiple, especially adolescents, can come in and do treatment at the same time so that they can associate with each other and still make sure that they're getting good treatment. So compliance in the clinic as well as compliance out of the clinic. It's a really hard thing to measure with scoliosis specific exercise because there's no specific way to objectively track that. And I think that is an opportunity that is out there that I'll talk about in a minute. Compliance with bracing is something that has been studied for a long time. How many hours of brace wear time is effective? And what's the most effective dosage? We see studies that are 23 hours of brace time in a day. And we see studies where it's closer to 12 to 14. What is the most effective? And the most effective is being more compliant. The more time you're in a brace, the more effective it is. Now there's kind of a steep curve where anything under 12, 13 degrees really doesn't do a whole lot. And so getting up to that is really important. But after that, is 23 the most important? Is 22? Is 18? There's a lot of debate on that, but the research on compliance is clear. Those who are more compliant with brace wear have better results, and that makes sense. Just anything with physical therapy, anything with bracing, the more you do it, the better the outcome. Assuming that that thing has been researched and found to be effective, and that you could be consistent with dropping 3 drops of water on your head to treat your scoliosis, but if it's not effective, it's not going to do anything. Scoliosis specific exercise and bracing have both been found to be effective, but you have to be compliant with them. You have to do it to make it work. You can't just have a brace sitting in a corner and have it work. You have to wear it. So I think this also has an opportunity. I was hoping at the SOSORT conference to see some technology that could help compliance. In bracing, there are temperature sensors and things like that. But in scoliosis-specific exercise, we really don't have that yet. And I think that is an opportunity to develop something that can help us with compliance. And so if you're someone who may want to look into that realm of how an app or AI or some other technology can help with compliance, feel free to reach out to me, and you can let me know your ideas and we can see if we can collaborate on something, because I think that's the missing piece of the puzzle the compliance with scoliosis-specific exercise is directly correlated to how well they do. And that is the biggest struggle. If you ask any SRA therapist, any scoliosis-specific exercise therapist, what is the biggest struggle? It's compliance. It's how do we get our teenage patients and our adult patients to do these exercises consistently. I think adults are a little more motivated. Usually they have pain. They're the driving factor with this. But with our adolescents, our juveniles, compliance is harder. And I think if we can figure out a way to address that, then I think we will definitely have better results. Those who are more compliant in my clinic here in Lehigh at Align Therapy do better. And that's just a fact. So if you are someone who's going through scoliosis treatment, make sure you're compliant. See if you can put reminders on your phone, get apps that help remind you, things like that that can help to improve your compliance, because your results will be better. If you have a brace, same thing. If you're going to be doing exercises and bracing, you might as well make it the most effective that you can. So thanks for watching. If you have one takeaway from the 4 takeaways that I've done from SOSORT, I think this is the main one: compliance. Make sure you're consistent, make sure you're doing it, and you'll get a good result as long as you're doing the right things. So thanks for watching. If you haven't watched the other 3 takeaways, watch those, and we will see you next time. Thanks.